something like that.
Wow. Okay.
Yeah. They made them. It was kind of brutal, but they had to just uh, basically do didactics and like study for shells up until that
Mm-hmm.
point. So they just got back shelf exams.
Uh-huh.
A little bit rough. They made it though.
What will you be matching in?
Internal medicine.
Okay.
Internal medicine. So, just actually telling Ugo, my sister-in-law, that um,
Oh my God.
he, made
Yeah, hi. I'm a second year at Hopkins, so we haven't done too much clinical stuff just yet. So everything is pretty much like lectures and online learning. But we do continue our longitudinal clerkship, which is like we go into clinic once a week next week. So I'm looking forward
Okay.
to that. Yeah.
And did you start that first year?
Yeah, we started in the spring of our first year.
Okay.
So we only did it for about 2 months, and then COVID hit, and then we had to stop. But then now we're starting to back up again.
Okay, everybody, we're just gonna go ahead and get started. So thank you, good evening, good afternoon, and thank you all for joining us for the first edition of Take the First Step. This is our healthcare panel, and I'm just gonna introduce myself. I'm Jordan Hill, rising senior at Harvard.
Hey everybody, my name is Giselle. I'm a member of the Lambda Upsilon chapter of Alpha Kappa Alpha Sorority Incorporated, and I'm a rising junior at Wellesley. All right, and they're gonna go ahead and have our panelists introduce themselves, their names, and then we have just a little background information on them for you guys.
All right, so I'm Dr. Dewana White-Satcher. I'm actually an assistant professor of pediatrics at Baylor College of Medicine and was in Lambda Upsilon chapter when I was there at MIT. Did you want me to go over my bio, or was someone going to do that?
We got you. You're good. Thank you so much. Yeah.
Okay.
So, hi everyone. Thanks for tuning in. My name is Colin. I'm a medical student at Duke in my final year of training now, planning to go into internal medicine. I'm a fall 13 initiate of the real new chapter of Alpha Phi Alpha Fraternity Incorporated. Graduated from Harvard in 2016.
Hi, everyone. My name is Ugo. I'm a second year medical student at Johns Hopkins. I went to Harvard, graduated in May of 2019, and I was initiated into Lambda Upsilon chapter of Alpha Kappa Alpha in fall 17. Thank you for having me.
Awesome. Thank you guys. So firstly, I'd like to kind of give a little background information on Sor Dewana. Dr. Dewana White-Satcher is a graduate of MIT, where she majored in chemical engineering and was initiated into the Lambda Upsilon chapter. After graduating, she attended Harvard Medical School, where she obtained a joint MD and MPH. She then completed her internship and residency at Boston Children's Hospital, and since that point, her career has been in academic pediatric medicine, where she is able to both practice clinically and participate in medical education. She has worked for Oakland's Children's Hospital, University of Chicago, University of Texas, and now Baylor College of Medicine. She is an assistant professor of pediatrics at She is an assistant professor of pediatrics at Baylor and has a clinical practice at Texas Children's Hospital. She is actively involved in both resident and medical education mentoring. Her clinical areas of interest include adolescent medicine with a focus on prevention of teen pregnancy and STDs, and immunization. So super excited to have you. Thank you so much, Sor. And then I'm gonna go ahead and give a little background on Sor Ugo. So she graduated magna cum laude from Harvard College in May 2019 with a degree in history of science. She is currently a second-year medical student at Johns Hopkins University of Medicine. And due to her genuine interest in addressing health disparities and advocating for the health of communities locally and abroad, Ugo was selected to participate in the Global Health Leadership Track. Alongside her coursework, Ugo also serves as the Vice President internal of JHUS chapter of the Student National Medical Association, and also maintains an active role in several medical mentorship and volunteer initiatives. So thank you again, Soros, for being here. Jordan's going to go ahead and introduce the next panelist.
Yeah, so I'm going to introduce Brother Marts. Brother Marts is an alumnus of Harvard, class of 2016, and a native of New Orleans. He is currently a fourth-year MD candidate at Duke University School of Medicine, on track to become a cardiologist. At Harvard, he joined the RONU chapter of Alpha Phi Alpha Fraternity Incorporated and was president of the Black Men's Forum, and to this day remains passionate about developing and uplifting Black men in his community. Professionally, recently he has worked on a variety of research projects and published a paper titled Exploring Racial Disparities in Patients with Severe Aortic Stenosis. Yeah, so just to get started, we wanted to ask you all how, if anything, has the COVID-19 pandemic changed your coursework, your course of study, or your day-to-day?
I can talk.
Go ahead.
All right. So in clinical practice, actually, what I found is that we're actually, because in pediatrics, it's really important that kids actually are getting vaccinated. And so we still are having children come in for their well visits and their vaccinations. And then our morning clinics are just based on well visits. And then we'll do actual virtual visits for most sick visits if they don't have to be seen in person. And so on those virtual visits, we're able to assess patients to see if they have symptoms concerning for COVID. And then we're able to send them through drive-through testing sites where we can get them quickly tested. And if they are negative, we can see them in a few days if their problem wasn't able to be addressed virtually. And we do find, though, one thing that does occur is exposures that are not anticipated. So we may have situations, for instance, last week I was out for a few days because a patient who we did not suspect had COVID, he was perfectly asymptomatic. He came for a well visit and then needed to go and get, he was going to be staying overnight in the hospital for a study. And so anyone staying in the hospital, they would go ahead and test. He ended up testing positive. And so as a result, since I had been in the room with him and his family for an extended period of time, despite the fact that I had on my protective gear, so I wear a mask and a face shield when I'm seeing patients, I had some allergy symptoms. And so as a result of that, the recommendation was that I stay out until I could get actually screened and tested, and wasn't able to return until my negative test came back. And so that's happening a lot. So we're often understaffed to some degree because every day someone may be out for exposure, most commonly for a patient who wasn't suspected to have COVID, so they were asymptomatic.
I just want to add that it's funny that you mentioned that, Dr. Satcher. While I was on my clinical rotations, I had 2 exposures in very similar circumstances to what you're describing there.
And the sad thing about it from a student standpoint is if you're only in a certain place for a short period of time, so if you're only on a rotation for a month, if you end up getting out for a week, that's a week of your educational clinical experience that you lose out on, unfortunately. So
certainly it's been interesting times to be in medical school.
Yeah, so our next question for you guys is what inspired you to pursue a profession in healthcare? So yeah, whoever wants to go ahead and start.
I can go ahead with this one. So for me, it was a variety of different factors, mainly like my family. So a lot of people in my family are in healthcare. So I always aspired to be exactly like them and take care of people for a living. And a number of people are physicians specifically. So that also motivated me to pursue a career as a medical doctor as well. But one of my biggest motivators is my brother. So my brother has autism. So serving as a caregiver for him, like alongside my sibling, my other sibling, and my parents and like other extended family, definitely showed me that this is what I wanted to do, like serve as a caregiver for many, many people for as long as I can. And then obviously, as I learned more and more about health disparities and different inequities in healthcare and in health, that further motivates me to like continue learning about and immersing myself in the healthcare field. So yeah, it's a combination of things that motivated me in the past and things that continue to motivate me to this day.
I'll just go ahead and give my spiel. And I think before I start, particularly for anyone applying into medicine, this is something, this is a question to really grapple with and spend time on, because you'll often find yourself writing about it during application season. So my story kind of is similar to Ugo's in that it really starts with family history. She spoke about a brother who had autism. For me, I think it was, at a young age, I noticed that both of my grandfathers had bypass surgery, right? Open heart surgery to repair, clotted blood vessels in their heart. Over time, with that being said, that morphed into, me kind of taking a caretaker role for my grandparents and, accompanying them to doctor visits. And then, in college, it became, a little bit more studying the social determinants of health, studying some of the physiology and science behind what can go wrong with the human body. At some point in making the decision to go into medicine, I realized, one, I really like in terms of finding something to do for the rest of my life, I really like the idea of, taking care of people. And two, kind of putting together the social determinants of health with the raw science, and realizing that, a lot of these medical problems that impact, communities of color aren't coincidence, right? It wasn't coincidence that both of my grandfathers had, open heart surgery at a young age. So I think that added a little extra motivation and kind of pushed me over the edge and directed me towards medical school. And here I am now.
And I'll say I was also always fascinated by the biological sciences and the science behind medicine. I wasn't sure exactly where I would fall in the medical arena. I enjoyed actually engineering also, so I wasn't 100% sure when I first came to MIT that I wanted to be a physician. I considered actually staying within the engineering field. And then at some point I thought, well, maybe I could do more biomedical engineering. But I found that I enjoyed actually more the working with people. And so that's, I think, the most important part of what I enjoy about clinical practice. I also enjoy teaching. And so that's something, I grew up, my mom was a teacher, my dad was a social worker. So we actually always did a lot of community service work. I did a lot of work with youth growing up in terms of, always, working with younger children, teaching Sunday school. And so I thought if I did go into medicine, I probably would gravitate towards the pediatric field. You get to do a lot of education of the patients, and you have a chance for long-lasting impacts because, it's when you're dealing with an adult patient, it's actually at the point where they've now already developed a lot of these chronic medical conditions. And there's a lot you can do to help improve their outcome. But, from the pediatric side, it's nice because we can actually intervene before they develop those bad habits and help to educate them about what they can do to make themselves healthier, and also educate their families to such that they're able to help their children grow up healthier.
Yeah, definitely. You each spoke to your communities having a very strong impact in leading you to the career field that you're in right now. And our next question is just, how has your racial identity in particular, I guess, shaped your journey, shaped how you all decided to join the medical field? And if there have been any obstacles that you all have faced, how have you overcome them?
What I will say is that I'm in academic medicine, and so whenever you're with the institution, there's always the political side of things, and there's always the old boys club, and things are getting better in that people are trying to actually help to make sure that universities are more involved in diversity and inclusion. So things have really progressed over the years since I first entered the field of medicine. But there were those issues of, when opportunities would come up, if you happened to know the person who knew about it, you'd find out about it before things were even posted. So that would give you an advantage. And so it was kind of an issue of who you knew. So sometimes I think as African Americans in a predominantly white institution, you might not hear about those opportunities as early as they were available. One thing I do think, although about my field in particular, which I enjoy, is I've chosen institutions where I'm predominantly working with minority patients. And I realize the difference it makes when patients see someone who looks like them, who they can identify with. So I think it makes a difference. Growing up, I actually don't remember ever seeing an African American physician. So I hope that in being in a minority community, I'm serving as a role model to the patients I see. I think that families tend to be a little more open about what's going on when they think that someone may be more sympathetic to their situation going on. There are times when maybe one of my colleagues or a medical student who's a non-minority may have gone into a room with a patient and they've come out with one assessment as to what's going on. And then I'll go back in and I'll talk with the family for a little bit. And I'm like, wait, you're way off. This isn't really something to be concerned about. This is something that, this is something culturally that you should have been aware is going on. So I enjoy the fact that I'm actually able to advocate for patients in a way that they might not if they didn't have an African American physician.
I can add a little bit to that in terms of like from the student perspective. So I haven't had much clinical experience thus far. So a lot of my perspective is based off of like my preclinical work. But it is kind of hard to always hear, like whenever you learn about various systems, like Black people or minority patients are more likely to get X, Y, and Z disease. And a lot of times, like it's not followed up with a full discussion of like why that is the case. So I think like for me, like that's something that I want to see moving forward, like in medical education. So having that experience kind of motivates me to encourage people to advocate for that change in medical education, but also just further hearing about, I've touched on this before, but hearing about those disparities and the fact that they exist also motivate me to continue to pursue a degree, like a medical degree, and to practice medicine, because we really do need more physicians of color to advocate, like Dr. Satcher said, for our patients. So while it is disheartening to hear about these things, it does further validate my purpose in medical education.
I just want to throw in there health disparities. When I went to school, it wasn't something that was even really talked about. And I'm glad to know that actually it is a part of medical education at most institutions nowadays. At Baylor, the first year students, their first week of orientation, they spend 2 or 3 days just talking about health disparities. And now actually there's more of an effort to talk about race in medicine. And right now we're trying to develop a curriculum that will be a longitudinal curriculum at Baylor, such that discussions about racial issues within medicine and the race is actually really to be more careful about when you're using race in medicine and not just attributing, oh, African Americans have a higher pain tolerance, when there's really nothing that shows evidence of that, and so there are other things where people make assumptions and it's really not actually true. And so to help educate people so they learn early on in their training so that they don't continue to perpetuate that and teach it to others.
I just going off what y'all have already said, I don't have much to add to this conversation, so I'm gonna keep my remarks brief. But I just want to, emphasize, from the medical student perspective, that first time that you realize that a patient, like you've impacted a patient care just by being present in the space, is priceless. And it's something that I've seen over and over and over again, even as a medical student. Walking into a room, being placed, having a patient, quote unquote, put under my care while I'm on some clinical service, and seeing that, the information that they're willing to open up about with me isn't necessarily something that a resident or even an attending physician was able to get. So one interesting thing I think at least one interesting conclusion that I think I've come to in seeing this is that sometimes it's not even you being the primary caretaker. It's simply you being in the space and allowing a Black patient to see that there are Black people walking these halls, right? Like, I'm not just a test subject, right? I'm a patient and entitled to equitable care. All those things can happen when a Black patient sees you in the hallway. So it really just reinvigorates your sense of motivation towards going into medicine.
And I'm just going to bring up one more point we didn't talk about. And I haven't seen it for a number of years, but part of it is based on where I'm practicing. Colin may have experienced it in his clinical experiences because he's actually still kind of there at the university hospital. There are going to be times, though, as happy as patients who look like us are to see us, there are going to be patients who aren't so pleased when you walk in a room. And I don't know, have you experienced that, Colin?
Absolutely.
So,
Absolutely. And it's an interesting encounter to learn how to navigate. But it's certainly something that you'll experience as soon as you start to get your feet wet into medicine. Sorry, Ugo, it's too late to turn around. You already did it. It's like, nah, but one thing I will say is that I've found myself able to find, have people willing to advocate for me and people willing to help me on this journey, so that when I do have those encounters, I don't feel unsupported. And I can't say that.
I think that's the important part about it, because I think it's happening more that more people are conscious of it and are being supportive, wherein there were times in the past when others have had experiences where if the patient said, I don't want him in the room, that they say, oh, okay, Colin, could you go out and do something else? Like, the patient doesn't want you in the room. And so I think it's great that people are more conscious about that nowadays. And are making sure that the patients recognize that, we are all part of the medical system and that we're there to help everyone, and that that they need to respect who their medical staff is.
Right. And I think I can't say, that it's been perfect, but one thing I will say is that, for example, just maybe a week or two ago, we had a discussion on the medical school side for first year medical students about professional identity formation. And one of the topics that was openly discussed and brought up by, the course director who's moderating everything was, how have you navigated some of these more difficult situations, especially when they, pertain to something about your identity, such as race, gender, sexual orientation, etc. So, I think the simple fact that there's an opportunity for a conversation, means that most often, at least, I think it translates nowadays into, medical students having a little bit of a voice and a little bit of a training on, how to navigate those situations and not, and having them not contribute to burnout.
Thank you guys so much for that. Kind of along the same lines, what has been the biggest difficulty getting to where you are today? Like what has been the biggest challenge or, getting to where you are right now?
I can think of a couple. I think one of the biggest ones, particularly early on before I was actually a medical student, like when applying to medicine, was, finding people who could relate to me in my, I guess, experience as a pre-med, and navigating how to apply to medical school, right? So being able to find that mentorship when I'm preparing for medical school was something that I didn't really have, and I think because of that, I made a lot of mistakes that, looking back, I didn't necessarily need to make. So with that being said, I would strongly encourage anyone applying into medicine to not just assume that you won't get into this medical school. Don't just assume that you need to have this certain MCAT, and or if you didn't make this specific grade, in some pre-med course, that just because of that, you're completely, like, your life chances of being a doctor are ruined. Like, everyone makes mistakes along the journey. And with that being said, there are always ways to navigate any situation. And I didn't necessarily have some of that, I guess, knowledge when applying to medical school. So I think it completely changed how I approached the situation, and increased the amount of anxiety I had when doing so. So I would strongly encourage anyone to make sure that, if you can, like, reach out to people in medical school, people that you might not necessarily know. Go on Instagram and find, Student National Medical Association members, right? SNMA is like the BSA for medical schools. Find people who will be willing to talk to you. Go to admissions offices at different medical schools and say, hey, I'm interested in speaking with a minority student about their experience, so that you can get answers to some of these hard questions that are oftentimes part of this hidden curriculum. That's a part of, one, applying to medical school, and even navigating medical school once you're there, because they can make all the difference in your process.
And I'll agree with you there. I think I did at MIT, I didn't have a lot of direction from a pre-medical advisor in terms of what it was to do. It was just kind of written out, here's the process, here's the courses you have to take, but there really wasn't much guidance about school selection, school choices. It was kind of me figuring it out on my own. And I don't know if it's gotten much better. I hope it has, but yeah. And so I think, some of it is, as you were saying, reaching out to other places. Harvard actually is right there. Harvard Medical School is right there, and accessible to so many of you who are at Harvard, Wellesley, and MIT, and the Boston area in general. And they actually have an excellent office of it used to be called the Office of Recruitment and Retention, which was kind of like a minority student affairs dean. And I forget its official title right now, but they have people there who are not only there to support them, the minority medical students that are there at the school, but to actually expose students. They have high school programs, they have college programs for students who are currently in college. And so going over and to talk to someone there to ask if they could put you, as you talked about, in touch with a medical student, because I think that helps you to learn more about the medical school application process that perhaps someone at your institution who's defined as your pre-med advisor may not have the interest in telling you, as you said, the hidden curriculum, telling you what you really need to do, telling you what schools are looking for, what to think about as you're applying. So I definitely advocate for that. And also looking into summer programs. There are a lot of summer research programs in medicine that I think it's good if you have that exposure, because then you have a connection with another medical school. And that in of itself puts you a little bit ahead of the game with that particular medical school that's not your home medical school. Sometimes they help to do things like MCAT preparation during those programs. So those are all things that if you're able to take advantage of them, it just gives you a heads up. So.
Yeah, I can add, I agree wholeheartedly with everything that was just said. And to point to something that was difficult for me, there's just too many. I feel like the whole process is difficult. Like medical school, like it's just a long journey being a pre-med student. So I definitely agree that like finding mentors is like step one. And not only, like you said, like faculty mentors, but like peer mentors as well. So like Colin, for example, was like super helpful for me, like when I was considering schools to apply to. Like people who like have been through the process, like can tell you what went right for them and what didn't go right for them. And also just to speak to your point about programs, like programs that help prepare you as a pre-med student or give you like MCAT prep X, Y, and Z. There are some programs that, at least in my case, that some of my mentors pointed me to that like were very, very hard to find online. So you don't have to go through the whole process yourself, and like navigating, finding resources on the internet is just very, very overwhelming. So having people who could tell you what they did or tell you what someone they knew did is extremely helpful. And even now, like I still talk to mentors who point me in the direction that I want to go in to reach my goals. So mentorship is extremely, extremely important.
Can you mention a couple of summer programs that that you found along the way? Because I'm not up to date on the ones that are out there now.
Yeah, for sure. So I did one, and this is one that like I just stumbled upon because one of my mentors told me about it. So it was the Harvard Summer Research Program in Kidney Medicine. And I did that after my freshman year, and it was actually, I did it on accident in a way. So I ended up working in a lab of someone who was participating or was a mentor in the program, but I didn't actually apply to the program itself. So that goes to my point that like a mentor really, really just was looking out for me and kind of like, I don't know, set me up in a way so I could succeed. So that was one that I did. I also did a program in for the San Francisco Department of Public Health. And it was just, it doesn't actually have like a official name, but I got funding from the Harvard Center Public Service for Interest Careers Center. It's CPIC. I don't actually know what CPIC stands for, I'm sorry. But they have a bunch of like funding opportunities for students. So that was an opportunity that I got in San Francisco that wasn't paid, but I got funding for it from Harvard. And then just like a program that I did here in medical school. So I'm interested in ophthalmology. And one of my mentors pointed me to ophthalmology minority summer research program that wasn't really advertised, but she was looking out for me. So I think like those are a few examples where there were opportunities that I was able to do because people were like had my best interest in mind and at heart. So I really, really, really emphasize mentorship to so many people because like I couldn't have gotten this far on my own. And I feel like no one should really have to. Like it's really important to have people to help you.
Yeah, thank you all for that advice. I feel like that's something we hear across different industries, just the power of networking and constantly looking for different learning opportunities outside of your core curriculum at your school. Specifically, when speaking about the MCAT, what were some things that you all did to prepare for that? I know that it's a long process, but if you guys can speak on anything during that process, I know a lot of people would need that information.
Yes, so the MCAT was a beast, especially this new one, just because it's so long, right? And Ugo, I know you can speak to this as well, but I found the biggest barrier to doing well is like having the stamina to really be prepared on test day to go in there and be your best, as much of your best that you are at the beginning, at the end of the exam. So I think one of the probably best things I did moving up was like moving up in, or I guess building up and preparing, was to make sure I was comfortable, with the time that I need to be engaged. I did a couple like simulated full length practice exams. So I think, for example, like some of the Kappa practice tests when I started were like half of the actual time. I took like 2 back to back to simulate actually being there for the entire amount of time. That was helpful. Another thing that was extremely helpful for me was kind of starting off with an idea of where I was strongest at and where I was weakest at, and being strategic about how I attack those areas in preparation. And so when I started off, I realized that I was pretty weak in biochemistry, right? And that in particular, a weakness for me was in understanding the amino acid side chains. And that because I wasn't understanding the amino acid side chains, I was getting chemistry questions wrong. I was getting biology questions wrong, right? So I spent some time just working to memorize everything about the amino acid side chains. And as a result, I saw my score improve a little bit. I saw some points, come my way. So I think that's just one kind of example of how you can be strategic during your MCAT preparation. I know that, when you first kind of open a book or anything, it seems like a lot of information. My best advice would be to make sure that you give yourself enough time to make the progress you want to make. On top of that, try and work smarter, not harder, so that you can break down your weaknesses and approach those rather than trying to just be perfect at understanding everything.
Yeah, MCAT prep is hard. And unfortunately, it's one of those things where if you ask different people, like you're going to hear different things just because like people like retain information and learn things in different ways. But I think one thing that everyone can agree on is that you have to put in a lot of time to like do well in the MCAT. For me, what ended up, I don't want to say what ended up working best because I feel like I could have potentially done some things better. But I ended up studying during my winter break. And at Harvard, that's about like 6 weeks. And I really liked that because like I didn't want to have to juggle schoolwork and MCAT because I can't, like it's just too much. So I just wanted to pick like a time that I could have intensive like MCAT study period. So I would say for anyone who's like trying to figure out what to do, I would advise doing that, or like if you need longer than that time, like that's perfectly okay. And like, obviously that's probably encouraged, but I think it's really, really good to have a time where you just focus on the MCAT and make a study schedule. There are study schedules online. And like, if you don't find one that you like, just look at your materials and try to make one on your own. I think just the hardest part for me was just staying on schedule and like having the discipline to like study every day for like a certain amount of hours every day, making sure I'm covering all the topics and take practice exams like Colin said. So if you just write everything down and like plan ahead, I think that'll put you in really good shape and make sure that you're like in good shape for test day. Yeah, so that's all I really had to say about that.
And this is an exam, as they're explained to you, that you can cram for. you can't just kind of the weekend before just kind of get out a study book and just go take your MCATs. This is something you really have to prepare for. And this is actually the start of many exams that you'll have in medicine, because the testing will continue throughout your entire medical career. And it's a good example of how you may do for subsequent medical school standardized exams, because it's an issue of learning to be disciplined and set up a study schedule and plan out how you're going to do it so you can retain that material, because it all, builds on what you learned before. So if you go in with a good MCAT preparation where you actually retained that information and just didn't keep it in your mind for that exam, actually it will help you when you get into medical school.
Definitely. I know a lot of people on here are appreciating your guys' advice and just like outlook on that test. Kind of along the same line, so for Dr. Satcher would be, how has working with patients differ from med school or even undergrad? And for the other panelists, how is med school a different experience or a similar experience to y'all's time at Harvard?
I think the biggest thing when you're actually practicing on your own, as a medical student for sure, you could come up with what you thought was going on. There was someone who was always kind of double checking things. And so you knew you had someone who, could make sure that they had your back, if you weren't right on target. I think the first year of actual practice, when I was done with residency, you felt a little intimidated. Sometimes you're like, okay, I'm making the decision. Like no one else is going to have any input in what I'm doing. And although I know this should be right, sometimes, especially if it was something serious, it could be a little overwhelming at times. But I think the good thing about it is recognizing that it's the same for a lot of people. And so there's always a phone a friend. So I had friends who, I did residency with who, we would like call each other up and say, okay, and they said, of course, like you got it. It just felt good sometimes. So then after a while, you get to the point where you're not calling someone for that phone a friend advice. You know what you're doing. You're confident because, this person's life is dependent on what you're doing. And so you don't want to make a mistake. So I think I'm actually more appreciative of physicians when they finish who are conscious of that than those who are a little cocky and say, I got this, I know everything. And, those are the ones who are more commonly the ones to, make silly mistakes and potentially that could be potentially life-threatening. So I think that was the biggest difference, knowing that the patient was totally dependent on you. As a med student, especially as a med student, and it's a progress because as a med student, you're playing a role. And as med students, you actually do get, and Colin, you can talk with you about it, how you actually get to go and see patients and you get to interview them and you can take your time, spending time with them. And you can intimately get to know one patient and take care of it. But when you're practicing, you can't take all that time. You have a limited amount of time you can see each patient because you have to get through things. And what you'll find is medicine, it's not just the practice of medicine anymore, it's the finance of medicine. And so that wasn't something I worried about as a med student. It wasn't something I was conscious as a resident, but as a practicing physician, it was kind of like, okay, here are your targets. And this is the number of people we want you to see, because if you don't see this number of people in this given period of time, we don't make enough money. And so you had to be conscious of that, and you didn't want your patients waiting. So you had to learn to be efficient. And, hopefully those are skills you learn as it progresses. You're more efficient as a resident than you were as a medical student. And so it's something that will come as a natural progression, but it's a different experience because you not only have to be accurate and careful, but you also have to be efficient because you have to make sure that you're providing the best care, but you're doing it efficiently. So.
That's a fantastic point. And like I can definitely attest to that. Like learning efficiency is probably one of the biggest steps you make as a medical student. from your clerkships to your more senior rotations, such as your sub-internship. During your clerkship, I think the focus for me was making sure that I asked all the right questions when I interviewed the patient, right? But during my sub-internship, I think the residents, the attendings evaluating me were more interested in, was I able to evaluate the patient, get all the orders put in, and get on to the next patient efficiently so that I wasn't there all night, right? Right there, there are levels to this, more or less. So it's definitely something that I think changed a little once I started seeing patients. Another interesting thing that I learned once I started seeing patients and kind of transition from like learning material and coursework is that everyone in medical school, if you're going to be a doctor, it's in your best interest to also learn how to be a good teacher. Because when you're seeing patients, you're gonna have to, learn how to convey information to them and teach them about something that they may have no idea about, right? Their level of understanding may be varied when they step into your office. And regardless of what that is, you have to be able to pull out whatever metaphors, whatever examples, whatever necessary to get them to buy in to, improving their health or treating whatever disease, they're coming to you for. So I think that was the biggest surprise when I jumped onto the wards was that, you say something to a patient, right? Like you tell a patient they have diabetes, and you ask the patient, and you start talking about some of the new medications that the medical team is considering, and they're like, "What's that?" Like, "Whoa, slow down, doc. Like, take your time, explain some of this to me, right?" Or you tell a patient, right, that they have heart failure, and you're like, and they're like, "Wait, what does that mean? Like, is my heart like, am I gonna have a heart attack soon? Am I about to die? Like, what does heart failure mean, right?" And you have to take a step back and learn how to explain some of these things in a way that the patient can understand. So it's definitely something that I was surprised by, but something that I wish would be stressed a little bit more often in, I think, preclinical and even like pre-medical training and advising.
It's like the biggest difference for me up until this point, like comparing undergrad to my experience as a student now. I feel like a lot of times in college, like you're learning for the sake of a class, like to get through the class and to get the grade you need to like just be done and move out, right? But now it's like every block, like you're learning for the sake of like not only your own knowledge, but for the well-being of your patients in the future, right? So you want to make sure that you're learning things well, not only for like yourself, like so that you can do well, but so that you can be able to take care of patients in the future. So gone are the days where it's like, okay, I'm done with this like course. All right, moving on. You have to like keep on reviewing the stuff. And like Dr. Satcher mentioned earlier, like there's so many tests, like you have your boards moving forward, and like when you're a practicing physician, you still have to like renew your license and things like that. So like you're gonna keep getting tested. So it's in your best interest to try to retain as much information as you can. Colin with the book.
They don't stop.
But yeah, no. But apart from, doing well and like doing well on your exams, like people's lives are in your hands, literally. So you have to make sure that you are learning stuff well. So that's like that's been a shift in mindset for me moving forward, and now comparing to before.
And then the other thing I deal with is actually because I teach residents and we're working with residents, being conscious of giving a resident or a student a little bit of autonomy so that they can feel that that they can learn how to interact with families and do that, but also double checking things, because I don't want a family to have a bad experience at the expense of someone else's education. So it requires going back and looking at the prescription that every resident writes and making sure that their dose was appropriate and correct. So getting used to doing that, because, I would just write the scripts as a resident and someone would sign off on them. But, it was going through. But so as a faculty, I actually have to go back and look at things and make sure that residents are actually doing things appropriately and then giving feedback. Because if someone's now written a prescription at 10 times the dose of whatever that a family is supposed to get, well, just changing it isn't good enough. I have to go back and make sure they understand that they made that mistake so they won't make that mistake again.
Thank you. These are kind of directed towards my source here. Someone had asked in the chat, how have you navigated your field as a woman of color, and specifically a Black woman in the medical field, whether it's in med school or as a practicing physician?
I will say, I touched a little bit on it before, how, there's a lot of politics involved in academic medicine. And so I think that's probably been one of the hardest aspects, and, finding out who it is, because it's not like everyone's going to tell me the secret pathway or what the hidden curriculum is and what is needed to be done to make those advancements. And every now and then you find someone along the way who will share, but making sure that, I'm keeping abreast of what's going on to make sure that I make sure I take advantage of opportunities that are there. So.
Yeah, and for me, like it's tough, right? Like you're like, not only are you a woman, but like, you're like minorities. So like in a lot of situations, like at least for me, like dealing with imposter syndrome has like been like really, really real. And there have been times that like I've had to like remind myself, like, I'm here for a reason, like I'm worthy of being here just like everybody else is, right? But something that has really helped me is like having a community of people. So like finding other Black women, not only in my class, but in years above me, and also like faculty mentors as well. And like hearing about their experiences and like things that got them through it, like has definitely been useful for me to like move forward and like, I don't know, mitigate these feelings of not belonging and like not being like worthy enough to occupy a space like in my class. So yeah, just definitely community is very, very important.
The other thing I will say, even, and this is probably more of an aspect of being a woman in medicine, as opposed to, and this is actually experiences in medical school, as opposed to being African-American woman. There are certain specialties, or when you're in the hospital setting, I found that there was more deference given at times to male medical students than female medical students. And sometimes it wasn't just on the patient side. It also came from the nursing side. One of the most poignant times came when I was doing a surgical rotation. And part of a surgical rotation is you have to, before every surgery, you have to go in and put on the surgical gown. You have to put on gloves in a sterile manner to make sure that you're appropriately sterile to participate in the surgery. And part of the operating room nurse's job is to help the physicians get their gloves and their gown on in a way that keeps them sterile. And of course, the first nurse that goes in the room has learned a way to do it on her own, so she doesn't get assistance to do it. So I do remember there was one time when I went in and, just like everyone else, I had my hands washed and I was ready, and I went in holding up my hands, ready for them to put the gown on me and help me get my gloves on. And they were like, one of the nurses was like, "What are you waiting for?" I was like, "Well, I'm ready to go in the OR." "Oh, well, you can get it yourself. The stuff is right over there." So then I'm there trying to figure out how to get it on myself, trying to remember how they did things. And of course, the surgeon walks in. He's like, "What's going on? What are you doing?" I said, "I'm getting my gown on." He was like, "Oh, well, the nurses could have helped you." And then, of course, they go back and they're like, "Oh, yeah, she went to do it herself." "Okay, yeah, let us help you." So you will find that at times from the women's side of things that unfortunately there may be some people who don't give women physicians the respect that they deserve.
Yeah, thank you all for this time. This is going to be the last question for.
Just before, I have one more point to add on to that. because I think it's something that uh, like men on this call, people who identify as male on this call should really pay attention to, right? There's always an opportunity for you to be an ally in these situations rather than look the other way. And I think it's important that, one, you always come to these situations when they arise, especially in medical school, um, you know, as, from a place of humility in which you're willing to learn rather than coming from a place in which your immediate reaction is to be defensive about something, right? So I think that's like my first point, and also like the second point, like being an ally might be something so simple as, right, like when you're a medical student in the VA, where there are often always like male patients who will make like a misogynistic comment. You can either like redirect or kind of step in and say like, actually, the resident I'm working with, is my boss. They're the person teaching me everything that I need to learn. So they are more than capable, right? They're more than capable of taking care of you. So, when these conversations come up about gender in medicine, just work to try and be an ally, because I think we need more of that in medicine. And it's not something that's always stressed as much in curriculum and kind of like the practice courses where you learn how to be a doctor, but it's equally as important, especially in times like this.
Yeah, definitely. And yeah, so just to, I guess, wrap up our discussion, we're living in unprecedented times. And for a lot of the students who are watching this live stream, they've watched opportunities be canceled, research opportunities, chances to shadow a doctor, whatever it might be. So what career advice do you all have for these students to not only prepare themselves for medical school, for the MCAT, but also just to, I guess, find different opportunities to get involved with medicine and to continue to grow along the path that they're trying to get to?
And I think it's tricky. I think luckily or something, everyone's in the same boat. So the people they're competing for these positions are all in similar situations. And I think that programs and medical schools are conscious of that. And so they're recognizing that opportunities that they typically would expect a medical student to have done, they're more lenient if they see that that student hasn't done as much volunteering in a hospital as they might have done, because a lot of that's been cut off, or as many as have the research experiences that they typically might expect on the application. So I think everyone's conscious of that. I do think, though, to make sure that you're using the time that you would have done to do those things, using it wisely, and spending that time doing something to make your application still stand out. So are there volunteer things that you could do in the community? Are there other things that you can do to show that you're still committed to the field of medicine? So it may take a little bit of creativity on your part, but to think about something that will make your application stand out and realize that it's not going to just be, well, I couldn't do X, Y, and Z, so I did nothing. So think about what you could do. And it may be talking to, mentors, or calling up and making cold calls to people you don't know, to say, hey, I had plans to do a summer research experience, and, I wasn't able to do this, or I was going to work in this lab. What can I do? Do you have anything I could help you with? There may be people who have chart reviews that you can help them with virtually. There may be opportunities that you're not aware of. And so I just suggest that you look for those opportunities. So it's going to require some creativity on your part. But don't give up and feel like, well, I can't do it because I didn't do this, or I have to wait a year because I really want to do a summer research experience before I applied. So those are some suggestions.
Yeah, I would echo a lot of those things, that like everyone is in the same boat right now, like you said. So like everyone is going through the same pandemic, arguably like in different ways. But I think a lot of programs and like institutions are aware that like there's a lot of obstacles right now, and like they're not going to have the same expectations of applicants as like was the case before. But there are still some opportunities for people to get involved, at least like a lot of health professional students specifically that I can think of. For pre-med students, like you said, like finding remote research opportunities might be the way to go, or volunteer opportunities that some may be able to be done remotely. So like, for example, some people are like making masks. So if that's something that like you have a skill in doing, like you can easily do that from home, and that is volunteering. There's also something called like the National Student Response Network for health professional students. So I don't think it's something that pre-med students can get involved in, but for someone who is getting a health professional degree, that is a way to like remain active and have some sort of like provide some sort of assistance during this time remotely, or even like out in the community, like with proper like social distancing and like PPE, et cetera, et cetera. So I think just one, like, I mean, give yourself some grace. Like it's a tough time. So like if you can't achieve the same things that like you were able to do before, like it is okay. There's a lot going on right now, but also there are ways to still like remain active and like make an impact in the ways that you would like to. You just have to look for them or ask people, see what others are doing, try to get involved.
Yep, I don't have much to add. I agree. My best advice would be to, you know, find some way to find some uh, way to, you know, make this situation beneficial, or you know, make lemons out of lemonade. I mean, make lemonade out of lemons. But understand that you're not gonna like you don't have to change the world, right, to get into medical school. You just have to show some continued interest, um, and also be patient figuring out what that is to the extent that you can. Do the simple things like reach out to people who might be able to give you more advice. You know, everyone, you know, the panelists on this call are an example, and go from there. But most importantly, beyond all this, like take care of yourself. Like COVID is very real, and you shouldn't be trying to put yourself in any unnecessary danger for the sake of trying to get into medical school, right? Nobody, I don't think anyone is going to applaud you for that effort, right? Uh, so keep that in mind as well.
So yeah, we just want to say one huge thank you to you guys. I know the Rowe New and Lambda Upsilon chapter is super appreciative of you all. We truly do look up to the alumni of our chapters, and we're just so thankful to have you guys just like take this time to speak to us undergrad students. This is like a stressful time for us, worrisome time for us. So we just really appreciate it. And just, yeah, thank you guys again so much. We hope you guys have a wonderful night. And yeah, bye, you guys.
And if I could be of any assistance to anyone in the application process, you know, Giselle and Lambda Upsilon know how to get in touch with me. So please feel free to reach out.
Dr. Satcher, I might have some questions. Some residency questions for you.
Feel welcome to.
All right.
Thank you all.
Thank you.